When I first started the health industry and looking at people's challenges, I would address physical health stuff with physical health tools. I'd address restriction or pain or discomfort with, touch therapy tools, stretching, myofascial release, all that kind of thing. And I'd address the emotional side of things with, talking, coaching, getting into the real reason things are happening. But as I progressed with my study and reflecting on working with my clients, I realized that these things are just kind of symptoms of something deeper. And then we came upon the deeper structures of health, which I talk about, mental, physical, and emotional. But not only that, if the lifestyle is not preventing the depletion of these resources, mental, physical, and emotional, then we must have symptoms from it, which is going to be, for the most part, our mental pains, our physical pains, and our emotional pains, right? So then this made the lifestyle extremely important to deal with. If we're not looking at the quality of the lifestyle, what kind of mental, emotional, and physical nutrition is in there? Are there missing experiences, therefore the person is not doing the right actions or having half thoughts, leading them to places where they find out there is no nutrition? These are kind of questions you ask yourself as you're looking for the sharp points of stress in a person's lifestyle. Now, when we find them, we might have to address them. Of course, we have to look into why is that a result of the way the person is living. And being able to address this on all three levels allows us to outgrow that challenge, outgrow that stressor. And then you see that when we think of health in a full sense of the whole human being, we must talk about growth. And these are generally why all these pieces are talked about in stress recovery coaching.